totally walang tao na cancer-free. We have 20% cancer in our body na pwede yang mabuhay pag pinid ulit natin sila ng wrong food. Natutulog lang sila, nahihilo pa lang. So, kailangan yung sundalo ng katawan natin mas malakas kesa kanila. Uminom ka ng PPARs, gagaling ka. Talagang walang aksidente. God-given po. Thank you po.
Breast cancer stage 4 patient, and they tested Simply Nature liquid PPARs on the breast cancer cells. And what they found was that Simply Nature PPARs liquid actually induced caspase 3, caspase 9, and cytochrome C. So what this means is that Simply Nature PPARs liquid was able to induce cancer cell death in breast cancer cells of a breast cancer stage 4 patients. So with just these three properties of Simply Nature PPARs, it would go a long way already.
You gotta watch all your comorbidities. Our products are actually very effective for inflammation, very effective for managing blood sugar, blood cholesterol. All right. If you're using metformin, PPARs is actually clinically proven to work in synergy with metformin. So you gotta watch. That means your metformin dosage will be tailored downwards because you don't need so much metformin. It actually works in synergy together.
It enhances the immune system, so as you can see, helps you minimize the side effects of the chemotherapy. So it has good antioxidant properties, good anti-inflammatory characteristics.
Simply Nature! Always with you from start to healing!
Hi everyone, these are the important questions. Do I need to go for chemotherapy? How many sessions of chemotherapy do I need? What about immunotherapy? What about surgery? What about CT scans? Well, join us on our Simply Healed program every Thursday nights at 7:30 p.m. Singapore, Hong Kong and Philippine time. Our sessions are interactive, featuring a live Q&A with experts and doctors who will answer your questions in real time. You can type in your questions and get immediate, personalized responses. This is your chance to take control of your health. So take advantage of this informative and supportive experience. Visit our Facebook page and message us on Messenger to find out more. See you there this Thursday.
One reason why I recommended initially PPARs is because it can induce lung cancer cell death. The main reason why I tried PPARs liquid, and it did well for the patient. It helped with the tumors. The enlarged abdominopelvic lymph nodes were not detected. This was gone. So that was something that I was actually quite surprised. A 12-centimeter tumor disappearing.
Everybody turn to your neighbor and say, do more. Right? Don't just think there is no one product that will cure you of cancer. Okay, that is like it's like a scammer trying to sell you something. All right, it is a comprehensive approach. When you need surgery, do the surgery. But prepare for the surgery so that you recover well, right? And then if you need to do chemotherapy, radiation therapy, do it. So this is where PPARs really comes in. It's a gene activator, so it's a signaling pathway. It switches on your pathways, your systems. Then the other nourishment that you take will be properly used. Is it easy to understand now?
Now let's not keep you waiting. We are now officially opening the AMA or Ask Me Anything portion.
So she has to take maybe just the capsule or the powder just to regulate blood sugar. And then undergo the surgery. And after the surgery, to aid in wound healing also and for recovery, she can continue the capsule.
I can safely say this, all LJ products are great. But if you have acute illnesses like cancer, then we are a world of a difference. Because if you want chlorella, take chlorella. Diba? If you want spirulina, take spirulina. When you take Simply Nature PPARs, you're taking our microalgae for its PPAR agonist.
We're always with you from start to healing!
Yung sister ko had the symptoms of diabetes. Siguro 10 years na. Madalas siyang umiihi, tapos laging pagod, pumayat, mataas ang BP. Tapos siyempre, mga non-healing wound.
Yung sa paa po ni ma'am, paano po yun nag-start?
Okay. Kasi ganito yun eh. Yung first na hospital niya, not because of diabetes. Ang una niya, pneumonia. Ayan. Doon nalaman na may diabetes din siya. By accident. Right foot niya, may para siyang matang isda lang. Maliit na itim lang. Tapos napapaligiran lang siya ng parang dilaw na kulay na dilaw. Ring sa sugat na yun sa center. Tapos tinanong ko, bakit? Hindi niya daw alam anong reason. So sigurado ko dahil nga may background ako sa medical, siguro dahil yun ay lumala na yung taas ng sugar niya, hindi niya na monitor, hindi niya nabibigyan ng gamot, nagkaroon siguro siya ng komplikasyon. Yung nerve sa paa na damage na. So hindi niya na nararamdaman na may natapakan pala siya. So probably yun siguro yung nangyari. May natapakan siya, nasugat yung paa niya, maliit lang, tapos hindi niya naramdaman. Lumala. So nagkaroon siya ng lagnat on and off, nakahiga lang siya. So sabi ko sa kanya, so anong plano mo? Sabi ko, pa-check na natin yan. So pina-check namin as OPD. Chinek, binigyan, niresetahan ng gamot, tapos tinignan yung sugat, binusbos. Pero kapiranggot lang ang tiningnan. Tapos in-advise na lang kami, linis, at 7 days na gamutan ng antibiotic. After ng 7 days, lumala lalo. Yung pinaka-pamamaga niya, lumaki lalo. So sabi ko, ay, na-infect na to. Nilala ko sa emergency room. Ayun, doon nalaman lahat. Mababa pala hemoglobin, mataas masyado yung sugar, yung diabetes niya, talagang marami ng komplikasyon.
Ano po yung plans ng doktor niya?
Na-refer siya sa ortho. Ang plano sa kanya ay putulin. VKA or the below the knee amputation. Hesitant din kami pumirma ng consent. Then later on, ni-refer naman siya sa plastic surgeon. Nagsabi naman sa amin na maganda pa circulation. Might as well na tulungan na lang natin yung paa, linisin, wound dressing for twice a day, then debridement as needed, religiously. So yun ginawa namin, twice a day kami naglilinis, tulungan kami ng husband niya, hanggang ang nangyari, gumanda, pero andun pa rin yung plan na putulin. Hanggang makita na gumaganda na, ayun, hindi na naulit yung plan nila na maputol yung paa.
Kasabay po ba nun may mga tinitake pa siyang gamot?
Bukod doon sa antibiotics, bukod sa mga gamot na binigay ng doktor sa ospital, may tinake din siya na alternative medicine, yung PPARs. May kamahalan. So, sinugal ko para, kasi kailangan kung di mo isusugal yun, baka maputulan talaga. Kasi kahit naglilinis kami ng paa, tapos nagdidibri, pero parang slow yung healing process niya. So, I tried na painumin siya at 10 tablets at AM and 10 at lunch and then 10 at the evening. And the soft gel, twice a day also. So, religiously binibigay ko yun sa kanya. Dati kasi dahil nag-peak yung WBC niya, medyo nag-septic siya. Sa mga nakakaalam, sabihin yung infection kumalat na sa buong katawan. Kaya nagkaroon ng problema yung kaisipan na nawala sa wisyo. Dramatically, yun yung maganda doon. Dramatically, after 1 to 2 days, parang nakita ko siya ng improvement. Doon, nakita namin na sa help ng antibiotic and together with PPARs, sabi ko, maganda yung kinalabasan. So, why not continue? Hanggang nakita ko rin na gumaganda yung healing process. Tapos yung WBC, nag-dramatically from 46. Imagine, 46, dramatically bumaba siya ng 39, 33, 27, 19, 15, and then 11, 9, 7. So, nakikita mo talaga yung changes na nagawa ng gamot na yun. So, yung support ng family ay mahalaga sa recover ng pasyente. So, una, yun yung talaga nakikita ko, yung support system. Then secondly, syempre, with the help of the advanced technology, like yung mga ini-introduce ng mga gamot, hindi ko pwedeng alisin yun sa scene, sa scenario. So ako kasi, dahil nga nasa medical field ako, medyo alam ko yung mga ganyang mga alternative medicine and evidence-based ako. So sa PPARs, sabi ko nga, maganda yung result. Ito walang harang biro to. It's not joke. Hindi mo na ako binayaran So it's no joke. Talagang maganda yung yung nangyari sa kapatid ko, lalo na yung wound healing. Yun yung nakikita ko, yung wound healing talaga. Nag-granulate siya, gumanda yung circulation, nabuo ng laman, okay? Nagkalaman yung mga paa niya na dating wala. Makikita niyo naman sa picture, di ba? Dating wala, nagkaroon ng laman. So, na-prevent natin yung pagputol. I can say na effective. Okay, effective yung PPARs.
Ano yung ma-advise nyo sa mga patients na same case sa sister ninyo?
Okay. So, I advise them to try. Then, kagaya ko, gusto ko may ebidensya na experience ng on hand ng ate ko. So, ganun din yung papayo ko. Try to experience yung healing, try to take the medicine religiously despite medyo may konting kamahalan, but then kung titignan mo naman yung long term na gamutan, mas mahal yun. Tsaka hospitalization. At yung syempre, yung recovery. Yun yung maganda doon yung recovery, mapabilis. So, try ninyo. Hello, I'm Joel Elcano. My sister, diabetic since way back 10 years up to now. Because of Simply Nature, hindi niya na kailangan mag-amputate. Yung recovery niya, yung unti-unti, nagkaroon ng maganda, nagkalaman yung kanyang mga paa. Still recovering, yet nakikita ko yung magandang bunga. And that is because of Simply Nature, PPARs. And I trust Simply Nature.
Assalamualaikum warahmatullahi wabarakatuh. Bismillahirrahmanirrahim. Ako si Haji Norma Yusuf, taga Zamboanga City. Pero dito na ako nakatira sa Maynila. 13 pieces na bukol, pero yung mga iba maliit siya. Pero yung itong isa malaki siya, parang umabot na ata ng 3. Kaya nga ito sabi ng doktor, kailangan tanggalin na. May kaibigan ako, i-try ko daw itong yung PPAR. Pangalawang gabi, may naramdaman ako parang iba. Yung parang may langgam na parang gumagalaw ganyan hanggang dito, hanggang sa talampakan, ganon. Pangatlong araw ko, Parang kung sumakit yung dito ko, parang gusto ko talaga, pag ano ko ganyan sa CR, yun parang lumabas talaga na ano, ganyan, napakarami talaga. Siguro sunod-sunod yun, 3 araw, ganun. Tapos sabi ko, pagtapos yung dito ko, minsan yung parang, ganun-ganun ako, parang masikip dito, parang minsan sumasakit dito ko, ganyan. Yung nag-ano na ako dito, umabot na ng mga 5 days, ganyan. Parang nawala yung sakit dito, nawala siya. Parang hindi na ako ganun-ganon. Pag nagsalita ako, parang tuloy-tuloy na, wala na akong halos maramdaman. Kaya siguro, hindi ako, sabi ko, parang ayaw ko magpa-opera, siguro mayroon talagang gamot para dito. Binigay ng God. Ngayon, hanggang ngayon, parang maganda ang, maganda ang pakiramdam ko. Yung high blood ko, pag parang magandang tinanggal ko na yung sa cholesterol ko, hindi na ako, pero yung sa cholesterol ko, pag tinatanggal ko yon, parang hindi, mga 2 araw, parang masama ang pakiramdam ko. Pero ito, 14 days na, ngayon 14 days na, basta 2 weeks na, hindi ako uminom ng subastatin, wala akong nararamdaman na parang maganda ang Kaya yun, ngayon bumili pa ako ulit ng tablet. Oo, kasi sabi ko para para lumakas talaga sa akin ng Kasi nararamdaman ko talaga na maganda. At Norma Yusuf, ay bukol ako dito sa liig ko, 13 piraso. Umabot na ng 3 cm. Take ako ng PPARs 2 times, morning at saka gabi. Pag numulok ako, hindi ko na siya mararamdaman. At saka, kinakapa ko siya. Parang nawawala, parang wala na. Hindi ko mahawakan. Hindi katulad ng dati. Salamat, Simply Nature.
Good evening, everybody. Welcome to another episode of Simply Healed webinar. I'm Sheila, your host, and we're glad to have you with us on a relatively new setup of our webinar. Today, we're diving into real science-based solutions for better health. To quickly recap last week's webinar, we tackled a powerful topic entitled Strength in the Storm, How Cancer Patients Stay Resilient with Simply Nature PPARs. It was an informative session with plenty of great questions, well addressed by our experts. This week, we turn our focus on a deeply important theme because tonight's topic is entitled Supporting Chemotherapy Naturally. Guys, if there's one thing I've learned from many years of hosting our Simply Healed webinar and attending to our dear patients and clients, is that chemotherapy is a battle that touches not just the body, but the mind and spirit as well. Today, we want to shine a light on something that's often gets overlooked. How to support your body naturally while undergoing chemotherapy. Because while undergoing chemotherapy plays a crucial role in killing cancer cells, it is no secret that it also affects healthy cells. This can lead to fatigue, low immunity, digestive issues, mouth sores, skin sensitivity, and emotional stress, just to name a few, because there's so much more. But did you know, according to a study published in the Journal of Clinical Oncology, up to 70% of chemotherapy patients experience treatment-related side effects that severely impact the quality of life. But the good news is, supportive care can make a difference. In fact, many doctors today are now recognizing the importance of integrative oncology. combining standard treatments like chemotherapy with natural, non-invasive approaches to help the body cope, recover, and rebuild. Here's the truth. Cancer treatment is not just about removing tumor, it is also about restoring the balance inside the body. When your immune system is stronger, your energy levels are more stable and your detox pathways are supported. You're not just surviving treatment, but you are setting the stage to thrive after the treatment. And here at Simply Nature, we believe in a science-backed natural support. Our flagship products like Simply Nature PPARs and Cleansing Plus are rich in natural phytochemicals that help regulate inflammation, support immunity, and assist in cellular repair. These are all key factors during and after chemotherapy. Always remember that. And studies have shown that PPARs or peroxisome proliferator activated receptors regulates over 100 genes involved in the immune function, inflammation control, and cancer suppression. They play a pivotal role in managing oxidative stress and improving how your cells respond to damage, which is essential when you are going through chemotherapy. And while our products may or may be a substitute for chemotherapy, they may support the body's ability to handle it better. By how? Easily by having, first, better energy. Guys, just imagine a patient not tied up in their beds or wheelchairs anymore and are doing exercises even in the midst of their treatment. Another one is having better gut health. Those patients who, even though in the midst of their chemotherapy journey, are in the mood and craving for healthy meals. Yes, like I said, in the mood for juicing veggies and fruits and veggies, right? So another one, very important as well, is the better immune resilience or being able to prevent sickness easily. We'll talk more about that in today's session. And of course, this is your chance to ask questions too. We know you've read and heard many things online and it can be overwhelming. So in our AMA or Ask Me Anything portion, we're here to give clarity, share real science, and empower you with options. But before we begin, let me leave you with this. Healing happens not just in our hospitals, but also in your kitchen, in your mindset, in the support system you build, and the natural tools you give to your body every single day. So please stay with us and stay tuned until the end of the program. And don't hesitate to type in your questions in the comment section. The intention of today's webinar is to make sure we answer more questions coming from all of you for us to be able to empower you even more in your journeys. So without further ado, let's dive right in. Leading tonight's AMA or Ask Me Anything portion are two highly respected health experts. First off, it's an honor to introduce Dr. Jansen, a graduate of St. Luke's College of Medicine and a diplomate of both the International Board of Lifestyle Medicine and Philippine College of Lifestyle Medicine. Currently serving as consultant at renowned institutions, including Alta Integrative Medicine and Wellness Complex of Perpetual Health Medical Center Las Piñas, Tree of Life Wellness Center, Centro Holistico, and Simply Healed Medical Group, where he practices what we've mentioned earlier, integrative oncology. Joining him is a successful entrepreneur and seasoned international speaker who brings deep insight into the personal success and healthcare. He is the CEO and founding director of Simply Nature International, and of course, our PPARs expert from Singapore, Mr. Shyan Lim. Hello, Dr. Jansen, and hello, Sir Shyan.
Hi, Doc. Hi, Sheila.
Hello, good evening.
Good evening. Come on, let's start. Tonight, to the audience, I'm just feeling a little tired, but we are committed to staying here, and I hope the new format is good for everyone. So please share with your friends. We basically dive straight into the Ask Me Anything segment. So this is really a great place for them to ask their questions, right? Yeah, let's go, Sheila.
We're on it. We actually have a lot of questions save because we have thrown to us privately from our viewers. Now, first question coming from Ms. Jessica, can PPARs still help osteosarcoma stage 2B? Cannot operate because affected half of hip bone, so undergoing chemotherapy now.
Yeah, definitely. If you're undergoing chemotherapy, there would be plenty of side effects, no? That would be coming from that. So, if you want some support, no, from against the for the chemotherapy, then yeah, you can take Simply Nature PPARs.
Yep. Simply Nature PPARs will be a good help for you in terms of the best support now that you're going for chemotherapy. It'll protect your bone marrow cells. So for chemotherapy, red blood cell count is very important. So this will definitely help with that. All right. So I think I'm gonna make a guess with regards to Dr. Jansen. Both of us, I think, will be suggesting you take the liquid, right? Because you're going for cancer and you're going for treatment, that's the best. All right. So start from there, and if you have more questions, simply ask the Sheila or have a consult with Dr. Jansen. Yeah, both are good solutions.
Exactly. Thank you, Sir Shyan. Thank you, Dr. Jansen. Right. Very quickly, on to our next question from CE Cruz. Is that safe for patients who is allergic with penicillin?
Okay, so allergies. If you're allergic to penicillin, it doesn't mean that you'll be allergic to any other substances. Okay? But we have to be careful. Now, with Simply Nature PPARs, I haven't seen anybody who developed allergic reactions from it. I haven't seen any of my patients who reported any symptoms of allergies. No, so but this doesn't mean that it's completely, you won't develop any allergies from it. It's allergy free, 100%. No? So it's not 100%. But if you're someone who has allergies to medications, you have to be careful. Okay.
Yeah.
So in other words, don't always be guided when if you are entertaining on taking this, make sure you have a doctor with you. And if ever you're gonna start on this, start at a low dose first, then work your way up.
Yeah, I just want to add to that. This is true for everything. For people who have severe allergic reactions to some substances, right? So if your whole life you've never been allergic to anything, yeah, Simply Nature PPARs is unlikely to be the first thing that you'll be allergic to. Okay, so with that, but if you are a person with a very sensitive immune system, and there are many things you're allergic to, from common foods to many drugs, then I would say have Dr. Jansen's phone number ready at hand. Just in case anything happens, you can always ask him. Now, I want to do a special shout out to some people who are allergic to seafood, right? Because many people make the mistake thinking that because Simply Nature PPAR tablets are made from microalgae, that if they're allergic to seafood, they will be allergic to microalgae like Simply Nature PPARs. All right. So to be even more specific, some people are allergic to seaweed. Okay. So and people are allergic to iodine, or there might be some diseases that are very sensitive to iodine content. So you can't take iodine. Your condition will react negatively to iodine. Then many doctors actually warn patients about taking algae, because algae are commonly, like seaweed, can be rich in iodine. And so patients who are allergic to iodine should be careful. Okay, now this does not apply to Simply Nature PPARs. The reason is iodine is common in seaweeds and sea algae. Okay, so Simply Nature PPAR is not a sea-based or seawater-based algae. In fact, it cannot grow in seawater. Simply Nature PPAR's microalgae strain is actually a fresh water microalgae strain. So when you test for iodine, it's not detectable. So that means we don't have iodine. Or even if we do have iodine, like for example, if it's found a little bit in fresh water and gets absorbed, it is like untraceable. That means when we do testing for iodine, it's always negative, all right? So just in case anybody out there who's specifically sensitive to iodine, and then your doctor tells you not to take algae, they are correct because many algae are like seaweed grown from seawater. Our Simply Nature PPAR algae is a freshwater algae, does not contain iodine, all right? Thank you.
Thank you, Sir Sean. Thank you. Actually, I just want to say that it makes sense why our PPARs is also able to help those who have thyroid issues, kind of patients. So there. So for our before we go to our next question, I just want to quickly greet our viewers for tonight, starting up with this Edna Aveo. Also have Miss Lali Moreno, who is asking about how to have a consult with Doc Jansen Kalalan. That is the right thing to do. Just simply type in how to consult. Our caring HCS, Miss Beth and Miss Irish will get in touch with you individually. We also have Helen Kamunayan, Imelda Oracion, Dayo Ocampo, and A.D. Lindy. Thank you so much for joining us tonight. If you have questions, just simply type it in. Now, another question coming from Ms. Estrelita Corral. Can PPARs help with with a situation where breast has already wound?
Okay, you have a breast mass, then you have a wound on the breast. Yeah, as a result of the breast mass, no? Answer is yes. But the approach is this. Okay, if that's the situation of the patient, no, the best approach is still to go for the chemotherapy. Okay, because the chemotherapy will quickly, it's the improvement on the wound is going to be very dramatic. The improvement. Okay, chemotherapy can in just a few sessions, it can actually help stop anything that is oozing out of that area. Yeah, so in other words, it will, cauterize that area quickly to stop the oozing, stop the wound from bleeding. Now, for patients who's not willing to undergo chemo, then you have to be a little bit more patient. Okay. Nevertheless, the approach to that is a combination of cytotoxic treatments like intravenous high-dose vitamin C, pro-oxidant treatments, and a combination of, a proper wound cleaning, judicious wound cleaning, really, because the number one enemy of that would be infection. Okay, and with infection, of course, hygiene is very important. So you have to really clean and clean and clean. Now, of course, with the treatment, there will be oxidative treatments that will be done to kill the cancer. There should also be treatments that will support the antioxidant capabilities of the body, because you have a wound that's going to be inflamed. Okay, inflammation is going to be high. So in that regard, Simply Nature PPARs also works well. Now, this is very different from a diabetic foot wound or a simple wound, no? Because the wound is coming from a cancer. It's coming from a tumor. So it's the healing process is not that easy. You have to first address the root cause. Okay? But nevertheless, no, be patient, just carry on. It takes a long time. Okay, it takes a really long time for the wound to heal, but it will heal. Okay? And by long time, it takes months. Okay, months and months and months. So you have to be patient. All right. So this is the limitations, no, of natural treatment, so to speak, the natural way, integrative way versus the conventional side of things. Conventional oncology really is quite effective in addressing these kinds of cases, especially if there is a purulent or a discharge already. No, that's quite a lot, no, profuse discharge, no, coming from a breast mass, no, or breast cancer. So yeah, that's my experience. So at the end of the day, it's the patient's decision which treatment the patient would go for. But yeah, to answer your question, I use Simply Nature PPARs for these kinds of cases. I cycle it with other immune boosting supplements, no, so as not to form any resistance against the supplement. But yeah, it really helps. It really helps.
Yeah. I just want to second what Dr. Jansen says in with regards to helping with wounds. Yeah, I actually wanted to say something, but then I realized I won't say that one thing because I don't want you to do it. Okay, I don't want you to do it because we don't actually. Okay, and then I'll stop there. All right. I do want to say something. Doc Johnson's comment about cancer wounds taking a longer time to heal. Wow, Doc, that is something that I didn't know. I thought that the same healing agents for normal wound would be the same, but cancer wounds actually take longer to heal. And this is a good example where sometimes you really want conventional medicine, right? To at least close the wound up, and then you use natural, right, later to rehabilitate the body. I think this is if I had open wounds, and depending on where you stay, and how easy it is to take care of the wound, sometimes you just want to close the wound first. Even for small wounds, doc, using steroid gels like Neosporin, if you're camping or something like that and you got a cut while you are overseas, I think I would not want to treat it naturally. I would put the steroid healing cream, right? And within literally hours or overnight, it will literally stop. The wound will close. And when you're traveling, this is just something you don't want to risk new virus and bacteria that you're not used to because you're in a different country. So I think this is just a good example that sometimes we really have to be a bit wise on which approach. But as Dr. Johnson says, it's really up to the patient whether you want to use conventional or purely natural.
Thank you, sir. I just want to say I agree with Dr. Jansen based on my observation. It's actually a common thing. Those patients who have this kind of situation that their breasts are already wounded or with fresh wounds already are those ones that hasn't really considered doing conventional. And it's one important thing that our two gentlemen, our experts tonight, have been telling us that we should take action as early as possible to prevent these kinds of scenarios or getting into this point there. So for our next question, coming from Ms. Hasmin, known to us privately, is PPARs tablet enough for slightly high cholesterol and diabetes? 8.05 HbA1c, taking vidaglipine and gliclazide.
Sometimes. Sometimes it is enough, but really depends on your body, how long you have been diabetic, your lifestyle, yeah, those factors, no? And you can try. Take a look if it works for you for a few months. If it does not, then come see me.
Yeah, I was gonna say the same thing. For sure, actually, it should work, but you need to take at very least, all right, 20 micro tablets. 10 micro tablets twice a day. I would actually recommend making it at least 30 or 40, all right? If you just want to see results, stable and good results in a relatively short time. So relatively short time means in a month to see your blood sugar actually improve. And I'm sure you can test your blood sugar very easily, right? The test kits are so easy. You can just do it at home anytime. So yeah, that's it. If you want a more sure way, you can take the soft gel capsules. Okay, but I think the tablets, I agree with Dr. Jansen. The tablets are the first goal because there are many benefits of the tablets in addition to helping with your blood sugar and blood cholesterol at the same time. There is that nutritional aspect to it, which is definitely greater than the soft gel capsule. Like we said it before, soft gel capsules, powder extract, liquid extract is really going into the therapeutic arena where you want to see some healing for a medical condition, right? But the tablets are really one of the best supplements you can ever take. So yeah, I would also go with the tablets, but make sure your dosaging is at least 20, but really go for 30, right? 15 tablets twice a day. You should see good results. Yeah. And if you don't, go and see Dr. Jansen. Just a dosaging.
Exactly.
Yes.
Thank you. Yes, once again, for those of you who wish to have a consult with Dr. Jansen Kalalan, just simply type in how to consult. Our caring healthcare specialist, Miss Beth and Miss Irish, will message. Okay. I just want to quickly say you could also you may want to also consider Cleansing Plus since you are already having medication. I've learned that from Dr. Jansen. Okay. Another question coming from Mr. G. Which PPARs is good for prostate cancer stage 1 only?
Wow! First of all, it's so good that you caught it so early. Yeah, doc, your advice.
Wait. Can you read the question again?
One more time. Which PPARs product is good for prostate cancer stage 1 only?
Stage 1 liquid. Still the liquid, since it's
Oh.
prostate cancer.
Yeah.
Okay, people, regardless of stage, it's always it's always good to go for the liquid. Okay, because that's the highest concentration of PPAR. So this is from my experience as well. PPAR's liquid really has very dramatic effects compared to the other PPAR products. Okay, but again, depends on how ill you are, how severe the disease is. Okay, so some patients improve dramatically with the cheaper PPAR products, but if you want to have the best, yeah, go for the liquid. Always go for the liquid if you have cancer. Okay?
Yeah, same here. If you are really, really financially strapped, then go for the liquid at least 2 weeks to a month. And after that, you can downgrade to the powder. All right. Because once you start the momentum, you get the thing, your body fighting, and the cancer going in retreat, then you're in good state. Right? But for this particular patient, all cancer patients, yeah, it's always either the liquid, and then after that, move down to the powder, which is more sustainable financially. But I just want, Doc, I just want to share with you. I have a personal friend, really a personal friend, right? So, her sister is third recurrence. Not okay. So that means the third time the cancer came back. So really, it was a death sentence already. Every doctor from the US to Singapore told her nothing she can do. Maximum 6 months. This breast cancer coming back the third time. This patient actually survived another 2.5 years and very healthily, right? So that's a huge change from 6 months to 2.5 years. Okay. What happened was that she was on the liquid, and after she bought already 20 boxes of the liquid. As a friend, I also wanted to tell her, 20 boxes is quite heavy on the finances already. So I asked her, it's a friend. So I told her, there is still the extract powder, right? That is about, if you're talking about your monthly cost, it will be like 3 times less, and I think your sister is quite stable already. So maybe you might want to consider the powder. I needed to tell her as a friend also, sometimes, yeah, that's why sometimes when you're close to someone, you think too much. You start to think they are spending a lot of money as well. So to my surprise, doc, she actually said, no, the liquid is doing well, we're not changing. And they actually went on for 2.5 years, non-stop, every day, liquid. And no complaints at all. They were very happy with the results, even though at the end of the day, after 2.5 years plus, the sister still lost the battle to cancer. However, her whole entire time that she was fighting the cancer, and already there was no treatment possible because all the hospitals said no. She was actually healthy, moved around like normal, and it was good, right? But yeah, well, like what we say about cancer, you just don't know. But she had great quality of life, and yeah, she chose the liquid even though I told her there was a cheaper option. So just to share with everyone, yeah, there you go, right? There you go.
Thank you. Thank you, Sir Sean. Thank you, Dr. Jansen. Right. Another question from to us privately. What can you recommend for anemic people? Oh, this is good for those who are working graveyard shift.
Okay, anemia, you have to know the root cause first. Okay.
Okay, what's the root cause?
What's the cause of the anemia? Is it iron deficiency? Is it excessive bleeding? Is it nutritional issues? Is it genetic issues? Yeah, so you have to know these things before you treat.
Okay.
The most common of all these things, is iron deficiency, especially in women, because you have menstruation. But if it occurs in men,
a lot of iron.
you have to consider other things. Okay, so yeah, you have to know these things first before knowing the answer to the solution. But if you just want to know some supplements, no, that would be good to support patients who have anemia. Um, B complex, vitamin B, and C. Yeah, so yeah, the whole vitamin B from 1 to 12 and vitamin C. Those are the ones that's very, very important. For patients who are anemic, do not buy iron over the counter.
Okay, why?
Don't buy iron yet.
Why?
Yes, because if you have thalassemia, iron supplements will make your condition worse rather than good. If you don't know if you have thalassemia, then don't just take iron supplements, no, here and there. Okay, you have to go see your doctor first before taking iron supplements. Okay, so again, I'm gonna repeat this. If you have thalassemia, okay, thalassemia is one of the symptoms of thalassemia is anemia. Okay, if you
so
have
you
anemia, don't just take iron supplements because iron will make your condition worse.
Wow. Okay. That is something worth learning today. You know, Doc, I noticed here in Philippines, people self-medicate a lot.
Yeah, because a lot are over-the-counter meds.
Yeah.
So that's the reason why.
I'm surprised, you know. I think okay, number one, I think I'm a pretty well educated person in general. You know, so I'm very shocked that I can meet many Filipinos who are high school graduates, not even college graduates, but they know many drugs. They can go to Mercury and they recognize many drugs. So I do notice that in Philippines, people are quite familiar with many kind of drugs and they self-medicate a lot. So guys, don't do that. Don't do that, all right? You might misdiagnose yourself. You might be that one in, don't know, 50 persons that standard medication is not suitable for you, all right? So there you go.
Yes, and we keep on reiterating it here in Simply Healed webinar that you have to always coordinate with your doctor so you can regularly monitor your internal factors. Okay, so for our next question coming from Ms. Ruby. Oh, I think it urged her to ask this question because we were talking about the iodine content in our PPARs. Because the question is, what are the foods good for thyroid problems and what foods to avoid? Can you share a sample meal plan?
Okay. Again, you have to know what kind of thyroid issue a patient has. If it is thyroid cancer, then animal food products is a no-no. Yeah, all animal food products because animal protein can make tumors grow. Okay, so you have to be on a vegetarian diet. If you have goiter, for example, then goiters usually the issue of that is iodine deficiency. Okay, but nowadays you seldomly see iodine deficiency anymore, no? Because a lot of our foods are fortified with iodine, especially our salt. Now, if you're someone who's not, consuming iodized salt, you're consuming the table salt, the rock salt, then this can be an issue, right? What else? Yeah, so these things. So you have to know the what kind of thyroid disease first. Now, share a sample meal plan. Meal plans you get from nutritionist dietitians. Okay, so I am not a nutritionist, I'm not a dietitian, so I cannot make you a meal plan. Okay, the Society of Nutritionists and Dietitians actually just released a memo. Even the PRC of the Philippines, no, the regulating body, the government agency that regulates the professionals licensed here in the Philippines, announced that only nutritionists and dietitians can issue a meal plan. Okay? Because you study 4 years for that. So I mean, yeah. Let's be careful here because we're dealing with lives here. So make sure you get the meal plan from the necessary from the right professionals. Okay. So going to your question, no. Again, it depends on what kind of thyroid disease a person has. if it is thyroid cancer, then automatic the diet should be plant-based. Okay, not just plant-based. So it should be whole food plant-based, no, not vegan. Okay, because a vegan diet, sometimes there's a lot of processed foods involved in that diet. So it's not advisable. It should be a whole food plant-based diet, natural foods, okay, unprocessed.
Doc, this is a common question. Always asked to us. Doc, how about organic egg?
Okay, I ask you the question: is egg a plant? Okay, you answer, or else you go back to elementary school.
Exactly.
Yeah.
There you go. Thank you, Dr. Jansen. Thank you, Sir Shyan. All right, for our next question coming from Ms. Julieta Kalaluan. I was diagnosed with gallstone and fatty liver. After taking the prescribed medication, I went back to my doctor. He is now recommending an endoscopy because I'm still constipated and bloated. He wants to examine my colon more closely. Can I already start taking PPARs even if I haven't undergone the endoscopy yet? Just asking.
Yeah, of course you can.
Yes.
No problem with that, no? Yeah.
Yes.
So let me take a look at that. Let me read the comment again. So this person has gallstones and fatty liver. I don't know if surgery was done or not yet, no, but I'm gonna assume that it hasn't been done. So you have constipation as well and bloatedness. So okay, with this, no, constipation and bloatedness, you will notice that the bowel movement is slow. That's why there is stagnant or stagnation of bile. So hence you have stones. So the gallbladder is basically a storage of bile, and bile that was stored for a very long period of time in the gallbladder can crystallize and form stones. No, so one issue is, why are you constipated? So that question we have to answer. So it's either you have thyroid issue, or it's in your diet. Another thing, if you lack fiber, you can be constipated as well. There there must be gut dysbiosis as well because of bloatedness, and but you're constipated, no, there would be gut dysbiosis. Now, would an endoscopy be able to find that out? No. The role of the endoscopy is to look the anatomy of your stomach and the first portion of your gut to see if there are any ulcers that might be causing the bloatedness. Okay, because if there are ulcers, then that's an entirely another disease, no, that we have to treat first before addressing the other aspects, right? So I encourage you to go for the endoscopy. For now, it is perfectly okay to take PPARs. Actually, PPARs would even be beneficial for your case because PPARs is a prebiotic that can fix your gut microbiota, feed the good bacteria, and let them proliferate. If in case, no, you have inflammation in your gut, no, which is the cause of the bloatedness, then PPARs have very good antioxidant, anti-inflammatory properties, which can even help lower the inflammation. PPARs can also improve the metabolism of fats. So for your fatty liver, that's going to be quite beneficial as well. So there are a lot of things that PPARs would be able to target. No? So it would be good for you. But ultimately, we have to find out why your bowel movement is slow. Yeah.
Okay. Doc, I'm just assuming that for this kinds of scenario, it might be evident on the tummy size, right? But is it also possible, Doc Jansen, for a person to have a gallstone and fatty liver, even if it's not evident on their tummy area?
Yes, of course. There are a lot of very thin people who have fatty liver and gallstones. I just saw a patient a while ago. No? The patient is actually a construction worker.
Wow. So you would expect him to be quite fit, huh?
Yes, the person is quite fit, actually. Yeah, the person is quite fit, but he has fatty liver and gallstones. You know why?
Diet issue.
Alcohol.
Oh.
Alcohol. It makes sense.
Yeah.
Because when I was working in the construction industry during summer vacations, yeah, a lot of alcohol and hard alcohol, not just beer. Yeah.
Usually
Right.
starts with that. Thank you, Dr. Jansen. Thank you, Sir Sean. Another question, very interesting, coming from Ms. Rana. Does BIRADS 5 ultrasound surely mean breast cancer?
No, not sure. Ultrasound is not the confirmatory test for cancer. Ultrasound is only is a test, no, to only have a better guess at what a tumor is. Is it cancerous or not? No? So that would give you ideas on the characteristics of a tumor if it leans towards a cancer or a malignant diagnosis or a benign diagnosis. The confirmatory test for cancer is biopsy. Okay, biopsy. That's the only one that can confirm if a mass is a malignant or not. BIRADS 5, just for everybody's information, the BIRADS staging. So you have BIRADS 1 to 0. Yeah, 0, 1, 2, 3, 4, 5, and 6. Okay. So the BIRADS scoring system is a system that was developed by doctors, radiologists, no, to give clinicians like me, your onco, your surgeons, no, to give clinicians an idea as to the probability of a tumor being malignant or not. Okay, so the higher the number is, then the higher the probability of a cancer diagnosis. Yeah. Okay. So that's how the BIRADS scoring is or was developed. Now for BIRADS 5, BIRADS 5 is a classification that tells us that a lesion is highly suggestive of malignancy. It is suggestive, highly suggestive. Now, if you are going to have a good guess, no, then probably around 70 to 90% of having a BIRADS 5 category, that would be a cancer diagnosis. Okay, so it's not 100%, in other words. Okay.
Thank you. Thank you, Doc. Thank you, Doc. Sir Sean. Another question coming from Ms. Chris Donato. Can I stop dialysis if I started taking PPARs?
You cannot. You cannot. Yeah, you cannot. If for patients who are on dialysis, no, or if you are being required by your nephro that you have to be on dialysis already, or if your nephrologist diagnosed you with kidney failure, okay, CKD stage 5 and stage renal disease, then at that point there's really no going around dialysis. That's the end. That's the end game. I mean, everybody who has this disease goes to dialysis eventually. Okay, why is it so? Because if you are diagnosed with stage 5 chronic kidney disease, then your kidneys are scarred already. Okay, the kidneys are scarred already. The scar will not go back to a normal functioning filter. Okay, so unfortunately, that's what it is.
Yeah.
Yeah.
I still
However,
yeah, go ahead, Doc.
Go ahead.
Right. However, I'm not saying that PPARs is totally useless at this point. No? It still has a lot of value because, again, if you are someone who has stage 5 chronic kidney disease, expect inflammation to be high. So taking PPARs would not only feed, again, your gut microbiota, no? That would also help lower inflammation. So, yeah, PPARs at this point is still quite beneficial. Okay.
Yeah, I wanted to share is that this year we're still working with the members of the National what's that called? Dialysis Center Association. Basically, they are the owners of dialysis centers, and many of them, or I would say most of them, are actually nephrologists by profession, right? So we actually know one of the ex-presidents, and we're working together to do initial pilot trials and everything. Why? Because we found that Simply Nature soft gel capsules are a wonderful aid to dialysis patients, right? It actually improves their quality of life and also improves their condition. Our experience, why they're interested is number one, our experience coming from patients is that they feel better while they are on tablets and soft gel capsules compared to dialysis patients that are not taking any supplements, right? So you should all know that once you go on dialysis, your diet is very restricted. You are pretty sensitive to what you eat. You can't eat like you used to, right? Things like that. So we're looking at that. And what Dr. Jansen says is the key thing here is this, right? We answer your question this way because the way you phrase your question suggests that you want to avoid dialysis and try PPARs instead. So the answer here is no, because it's dangerous, right? Your kidneys are not functioning. That could lead to a lot of complications. So go for a dialysis first, right? And then start on Simply Nature PPAR protocols if you want to see if things can be improved. And you want to go for a Hail Mary, you never know, that's fine, but you don't have to not go for dialysis to take Simply Nature PPAR protocols. Okay, so I think that is a very important key difference when you ask that question. So we say if your nephrologist says that you have to go for dialysis, there's no waiting anymore, you have to do it now, then do it. Okay, then that doesn't stop you from taking Simply Nature PPARs and see if what kind of improvements that you can make. Maybe it will lessen the number of dialysis times that you take and how you feel while you're going through dialysis. So one of the key things when a person goes on dialysis that I first learned from Dr. Jansen when he did a special series on CKD was that I was quite shocked. I never knew that statistically speaking, you just Google, right? You just Google life expectancy of dialysis patient. And I was quite shocked. It says that statistically it's about 5 years, right? So I was very shocked. I never knew that going on dialysis is actually having kidney failure will lead to a shortened lifespan, and shortened to 5 years is quite a lot, right? If you're 35, that means 5 years you will only be 40 years old. So suddenly there's an urgency. What else can we do for a patient undergoing dialysis? It's also true, many dialysis patients, a good like 30-40% have lived like long lives, okay? But there's a very high number that don't. So no, it's a good idea to go on Simply Nature PPARs, tablets, or better still soft gels. Why? Because the tablets have the soft gel will remove a lot of macronutrients, and that will lighten the load as well. What you want is the benefits of Simply Nature PPAR extracts. So the soft gel is very sustainable price-wise and no complications with your dialysis. So let's see from there. This is something that we are going to revisit over the next few years and keep our fingers crossed as more and more CKD patients undergo our using our products together with their dialysis. We might be better able to advise you next year, right, on what are the results. So on the very least, it's going to help. Okay, but maybe we keep our fingers crossed for amazing developments, right? Developments that surprise us, doing better than what we had thought. All right, yeah. So there it is. Yeah, go on to Simply Nature. I would say soft gel capsules first. Then as things stabilize, you can try the tablets if finances become an issue, right? And the tablets are very affordable. Sheila?
That's right. Thank you. Right, let's try to answer, I guess, 2 more questions for tonight. Another question is this PPARs applicable to endometriosis?
Okay, endometriosis is an anatomic problem. So this is when, this is a condition when the endometrium migrates elsewhere. Okay, so that's basically endometriosis. Now, when when a woman has her period or menses, the area where the endometrium migrated to, that will also hurt. Okay? That will also hurt. So, and for endometriosis, the problem here is anatomic. So the solution for endometriosis is also likewise anatomic. So it's really surgery. Okay. However, we don't just operate on a patient. If the patient was diagnosed with endometriosis, first we have to manage the patient with hormones. Try to fix the hormones of the patient so that the period is not as bad. But we really cannot remove the endometriosis, the endometrium that migrated to that specific area of the body. Okay. So with PPARs, will PPARs make the endometriosis go away? No, but PPARs can help in managing the hormonal sequelae of the patient. Okay, but that doesn't end there. You have to go see an integrative medicine doctor who specializes in managing hormones to help you correct the hormonal imbalance that your body has. Okay, so endometriosis also arises because of heavy menses, which goes back to the hormonal imbalance, the hormone problem that you might have in the first place. Okay, so the role of Simply Nature PPARs here in these patients would be to fix the gut. Number two, lower inflammation. With fixing the gut and lowering inflammation, usually the hormones would be able to correct itself. But of course, it doesn't always happen. So you need guidance, or other necessary other supplements, other medications, that would help manage the hormonal imbalances. Okay.
Thank you, Dr. Jansen. Thank you. Sir Shyan, would you like to add anything, or shall we go to the last question?
No, let's go to the last question. Yeah.
All right. Well, I'd like to incorporate both two questions for tonight because it has something in common, which is about multiple breast cysts. So the question is how to confirm if there are multiple breast cysts, and if it's already multiple, and if the patient is also experiencing pain in the chest and at the back area, which is tingling pain, what or which PPARs can you recommend?
Initially, if the pain is really, really bad, I would recommend the liquid, just a few weeks of the liquid, probably 2 weeks or 3 weeks. We can go for, 2 weeks first. And then to diagnose further, because the pain can be a lot of things. A pain can be just musculoskeletal. Breast cysts don't cause pain on the back. It can cause pain on the breast itself, especially when you are on your period. But most often it doesn't cause any pain at all. Now, if you are experiencing, so another issue would be costochondritis. So that's musculoskeletal pain, not totally related to the breast cyst or to the breast at all. So that can be an issue as well. Can there be a more sinister reason why you have back pain? Yes. One example would be lung cancer. Okay, so there are a lot of diagnoses that should be considered. So you have to go see your doctor to know what kind of test would be good to recommend. Okay, yeah.
Sir Shyan?
Wow. No, I just saw this question by Ritz Belendez.
Yes.
Yeah, I just want to answer because I think she would need to hear an answer from us now, Doc. She said she's scheduled tomorrow for her third biopsy to get her HER2 tested. She's worried, but it's the onco's instruction. Her lump has extended to her armpit, so painful, as if the arm were fetched to my shoulder. I don't know what she means, but probably it's just very painful. The lump is big, stretching the skin in my armpit. Can this be operated on? What PPAR is suited for me? Straight off, I just want to say, in your condition right now, take the liquid, right? It could surprise us. It could surprise us, right? At this point, if you want something that could possibly lead to a positive outcome that is surprising, try the liquid. Now, whether it's operatable or not, your doctor will be the one to tell you, right? But you don't have to wait. It won't contraindicate. It doesn't affect anything that your doctor will do or prescribe to you. So yeah, you can even, correct. Doc, what's your advice for this person?
Yeah, go for the biopsy, definitely. No, surgery at this point, I don't know if it is applicable for your case at all. Really depends on how much the tumor has invaded the surrounding tissues. Um, so surgery, I don't know if it's applicable or not, but definitely there has to be something done to shrink the tumor first. So one reason why the onco is recommending another biopsy is there's a possibility that a very high possibility that the cancer have mutated. So I'm sure you have underwent previous treatments already. And right now this is the third biopsy. So the onco is trying to confirm what kind of breast cancer is proliferating or is spreading in your body. So hence the biopsy. Um, One advice that I would suggest, go for PPARs liquid. If you can go for other treatments, no, that can be used in combination with whatever your onco is planning, go for it. One such treatment is intravenous high dose vitamin C. So high dose vitamin C at very high doses is pro-oxidant. Okay, that can actually help kill the cancer cells. But the best way to approach this is to combine it with whatever the onco is going to suggest. Okay, so the killing power is multiplied, and we have good support because we're giving you vitamin C anyway. Okay, so that's what I'm going to do now for your case, and of course give you pain meds to help manage the pain. But pain meds is only going to improve it slightly unless you go for morphine. Yeah. So that's the approach. Now, if you want, if you really need help, go for a consult. Probably we can work something out. Yeah.
Exactly. I was about to say for Miss Ritz, please go for a consult. We'll definitely get in touch with you together with our caring HTS. So once again, for those of you who wish to have a consult, you can still simply type in how to consult. So we are able to schedule you a consult with our Doc Jansen Kalalat. Now, well, we are almost at the end of the webinar. As we wrap up this evening, we would love to hear your final thoughts quickly. I know that both of you are already tired. It's been a long day today. So just a quick parting words for our viewers for tonight. Would you like to start with?
Yeah, I'll go first. I'll go first.
Okay.
So, yeah. So thank you everyone for listening. Again, very good questions, no? Very interesting questions. New set of every single time, every single week we have new set of questions. So keep them coming. Now, although we're trying to answer the best we can, the questions. However, please don't take this as a consultation. We are answering the questions for educational purposes only. Okay? Not as a medical recommendation or for you to act on. All right? This is only for you to know what direction would be best to take. Okay? At least you have a direction. Now, if you are someone who would really like for me to look into your case, schedule a consult so I can make more appropriate recommendations. We can probably begin treatment as soon as we can. If ever you're waiting for some tests or some procedures to be done to you. Now, whatever your case is, I'll be straight. The best approach is to merge conventional and integrative oncology. Okay, the best outcome that I have experienced are patients who always fix these two. Now, if ever you are in a situation wherein conventional oncology is not an option anymore, or you just prefer not to go for it, there are still ways on how we can manage your case. But it's just going to be, the experience is going to be very different. Okay, that's what I'm gonna say. So if you are interested, so schedule your consult and we'll see how we can help you. Right? So I'll give the floor to Sir Shyan. Good night, everyone.
Thank you,
Good
Dr.
night, Dr. Jansen.
Jansen.
Thank you for always being here on Thursday.
Yeah.
I want to extend the same thank you to our viewers. Like the last question, I wanted to answer it because it really reflects on the amount of trust that a viewer who's in pain is asking a question. The fact that she will come on here and ask us this question is it lets us know how much you trust us, which is why Dr. Jansen and I always want to remind all our viewers everything that we share is meant for you to make as a reference. It cannot be consult, all right? And the reason why is we can't give medical consultation without knowing the full picture of your case. It's incredibly irresponsible for anyone to give medical advice that is just based off of a few statements that is being typed on a screen. Okay, so what are we trying to do here then? If we can't give medical advice, we can give you a general knowledge so that you know what direction. We can also give you enough information for you to know, okay, is this the direction I want to go? Is this the doctor I want to see? For example, many of you will have consults with Dr. Jansen because you get to hear what his approach is, right? How he goes about what is his strategy in general with cancer. A lot of times you don't get that when you want to go and see a doctor. You don't even know what the doctor's voice is like, how he's going to speak to you. You just go into the clinic hoping for the best, right? So here on our program, you get to hear Dr. Jansen's approach. You get to see how friendly he is and how much he cares for his patient. And that will help you to decide whether you want to have real medical advice from him. And if you do, please arrange for a consult. But as for me, what we hope to do here is also there are some things that we really can answer and give a very definitive advice. Things like, can I eat chicken? Can I eat beef? Is keto diet? We're not going to give you reference point. We are really going to give you advice on some of that, right? So these things we can give very definite advice. We can tell you whether simply PPARs will contraindicate with any of the drugs that you're taking. So those are straight out answers. But when it comes to your medical condition, specifically on what to do, go for a consult. But I hope the knowledge that we share over here will be enough for you to know what you want to ask your doctor the next time you see him too. All right. So this is what we aim to do. And I do hope that what we do blesses you and helps you on your journey to claim back your health, right? So we look forward to supporting you again next week. I hope you like our new format. We basically jump straight into the question and answers. Yes, and we do this for like an hour. All right. So thank you very much for joining our program. Share it with friends, and I hand the time back to Sheila.
Thank you, Sir Shyan. All right, well, everybody, thank you for your questions. Thank you for considering our program as program of value while you journey with your own health battles. And on behalf of all our patients and viewers tonight, thank you, Sir Sean Lim and Doc Jansen Kalalan, for putting so much effort and, of course, care towards all of us watching tonight. Now, if you or your loved one is battling any type of cancer or any health issue at all, remember, science is evolving and new treatments are available. So don't forget to like our Facebook page, Simply Nature International. Like and follow us, please. And of course, Dr. Jansen Kalalan's Facebook page and Simply Healed Medical Group Facebook page. And also subscribe to our YouTube channel for more testimonials or success stories. Now, this is also to make sure that you get updated with our latest promos and events. Now, listen carefully. Don't miss the last day of our free shipping today, July 17, Thursday. And so if you're planning to purchase anything worth 3,700 with the free shipping, then now is your best time. So reach out. Make sure to reach out to your assigned Simply Nature Client Service Officer to learn about and to learn about how to take advantage of this limited time offer. Once again, this is only valid through our website, www.simplynature.ph. So now is the time to prioritize your health and your family's well-being. We hope to see you once again in our next webinars to come. That is happening on July 24. That's another Thursday, same day, same time, 7:30 p.m. So because your commitment to healing and recovery inspires us. Remember, every step you take is a step forward, and you don't have to take this journey alone. Once again, this is Simply Healed webinar powered by Simply Nature and Simply Healed Group, because your curiosity about your health conditions and your victories over cancer and other metabolic illnesses are what keeps us going. Because here in Simply Nature, we're always with you. And start to healing. Thank you, everybody. Good night, and God bless you all.
Actually, walang tao na cancer-free. We have 20% cancer in our body na pwede yang mabuhay pag pinid ulit natin sila ng wrong food. Natutulog lang sila, nahihilo pa lang. So, kailangan yung sundalo ng katawan natin mas malakas kesa kanila. Uminom ka ng PPARs, gagaling ka. Talagang walang aksidente. God-given po. Thank you po.
Breast cancer stage 4 patient, and they tested Simply Nature liquid PPARs on the breast cancer cells. And what they found was that Simply Nature PPARs liquid actually induced caspase 3, caspase 9, and cytochrome C. So what this means is that Simply Nature PPARs liquid was able to induce cancer cell death in breast cancer cells of a breast cancer stage 4 patients. So with just these three properties of Simply Nature PPARs, it would go a long way already.
You gotta watch all your comorbidities. Our products are actually very effective for inflammation, very effective for managing blood sugar, blood cholesterol. All right. If you're using metformin, PPARs is actually clinically proven to work in synergy with metformin. So you got to watch. That means your metformin dosage will be tailored downwards because you don't need so much metformin. It actually works in synergy together.
It enhances the immune system, as you can see, helps you minimize the side effects of the chemotherapy. So it has good antioxidant properties, good anti-inflammatory characteristics.
Simply Nature! Always with you from start